Now, I don't really have to guess about this because there's already a House bill on the floor, HR 676, which is the most comprehensive Medicare for All bill that's out there. It's even more comprehensive than the Senate bill. And I've dedicated my campaign to supporting that bill as long as it stays structured as it is. You know, we have a few months. But right now, the plan is to get enough people that support that bill into office and just vote for it. It's there. We may have some amendments to put in, but the ACA, it was a giveaway to private industry. You can't mandate something and then not mandate that they keep the price relatively low. It has to go, and it's just a reality that we have to live with. You can't keep running on trying to save something that's dying and that isn't working, because there's a big difference behind actually covering people and having access to cover people. We all have access. There's hospitals all over the place. I can walk in, but do I have the insurance or the financial ability to cover the services when I walk in those doors? So don't let access confuse you when it comes to actually getting health care that you need.
So when I talk about healthcare, yes, you have to talk about how we cover people, but you do have to talk about access. You do have to talk about quality, because those are issues that I've heard on the campaign trail just as much as affordability. You've got people paying far too much, especially on the individual market, especially our farmers. We're paying in excess of $20,000 a year in premiums. You have people who are traveling hours to get to care, and when they get there, the quality of that care is the 5th different doctor that they've had in 5 straight appointments. All of this has to be talked about when we talk about reforming our healthcare system. And the guiding principle of this, I made federal policy in the Pentagon. You have to start of where you want to get to. And for me, that is universal health care. And there are many ways to get there, and I'm open to all of them. One that I am particularly interested in, because it acknowledges what we have here today, but also keeps us moving forward, is the idea of Medicare Extra for all. This is the Center for American Progress. I encourage you to look this up. This is a very comprehensive idea, spelled out in detail. And it's the idea that you take Medicare, you roll Medicaid into it, and then you make it more comprehensive so that people don't have to get a supplemental, because it includes vision, it includes dental, and it includes prescription drug benefits as well. And then every time a child is born in this country, they get wrapped up into that, and they're then a part of it. So the program keeps expanding and it keeps expanding. But at the same time, there are 150 million Americans on an employer-sponsored plan. Many of them say they like it. They don't really realize that it's not that great until they have to use it. But you have to acknowledge that fact. And the purpose of this system is that those plans have to compete. They have to provide better coverage. Otherwise, they're going to become the useless middlemen that insurance companies are in the first place. This is a plan that I think would have bipartisan support and would move us towards that goal of universal health care in the immediate.
First, I would implement and fight for my plan to save Medicaid as it now exists. The tax only applies on incomes up to $112,000. You pay it on all of your income. Other people don't. And that's how I would fight for it. I'd say, you are punishing people for living too long. That's why they collect more Social Security, have more Medicare claims, have more people going on Medicaid. Do you want to be a cheap conservative? Let's open it up. Let's change that dollar limit. Put it up to $200,000, we'll save Social Security. Then let's move to universal health care. Let's start with ground zero. As already noted, employment companies, your employer, often pays part of your premium. Let's start from ground zero. We need something that pays everything. We need a program like that. We need to look at how we will fund it. A lot of people talk about wanting this. How are we going to pay for it? One of the ways is the income subject to the OASI tax. There are other ways. We might have to raise taxes. Yeah, wake up, people. We might have to. But don't kid yourself that we have access. If Medicaid goes down the drain, a lot of rural communities are going to lose access. That is critical. That will be my first priority. In politics, you have to work bit by bit. Then I would move on to universal health care.
We are not free, or a free country, if we make all of our life-changing decisions when it comes to where we work and how long we work based on whether or not we have access to group health insurance plan. I'm an insurance agent. I've been working with these programs before, during, and after ACA. I've seen the good things and some of the things that needed to be changed. So there are some things that I would like to do. Drop the eligibility for Medicare down to 55 and move those people into a plan, as long as we make sure those reimbursement rates to our providers are high enough to keep that going. Then I would like to put a public option plan out onto the exchanges, because that is the market where there is no subsidy, like a group health plan is covered. When I was in the Minnesota Senate, I did work on a bill to try to get a waiver for Minnesota for us to put our Minnesota Care plan out there. Because I believed if we could make that work and we could get the reimbursement rates correct and prove to people that would work, that that's an option, then I'd like to open it up eventually so people that have a group plan and something else that they like can go into that. I've taken a look at the Center for American Progress plan, and I would really fight a lot that's in that plan. For one thing, we worked really hard for Medicaid expansion in Minnesota, and we got it. So you are eligible for free, no premium, at 200% of the federal poverty level. The plan there says 150%. We'd actually be going backwards on that. The other thing is the hospitals could opt out of actually participating in the plan. That would absolutely kill our rural healthcare system if we put forth a plan like that. Doesn't give the kind of reimbursement rates and the services that we can go to a doctor and go see, have a hospital available to us. And the other thing is that states would give over their ability to do their own and put grant money towards the federal government. I'm not in favor of that. I've seen how good we can do it in Minnesota. We were way ahead when it came to a lot of things in healthcare. And I know we've made a big difference in ACA. So I will work so that deductibles go down, our rural hospitals are available. Those are the two things that I absolutely want to make sure, whatever we do, we have those things available.
So, this is the key issue that's hitting our district and that I've been hearing about throughout the campaign, but I also experienced with my clients. And that's because of the high premiums and deductibles that people are having to face in rural America. In our district, farmers are having to pay $35,000 a year between deductibles and premiums. I've had too many clients go bankrupt. This healthcare thing is the #1 reason for bankruptcies. My wife, her patients can't even afford medications, so that what they're having to make is that awful decision between paying for food or medication. And continuing on, and this, now keep in mind, this is happening today under the ACA. So expanding a broken system to me just seems silly. I am not for that at all. And that's why I've been campaigning throughout, and I will fight tooth and nail for us to actually roll as fast as we can to a Medicare for all system. I've also taken a look at the Medicare Extra. That has a rollout plan of about 60 years. That's too long. We can't wait that long. We need to do this now. Our rural clinics are closing today. We have people who can't get access today. If we do a comprehensive Medicare for all from cradle to grave, we can make that implement real quick. Other countries do this at half the cost that we do. It'll cost $1.7 trillion, which is less than the $3.3 trillion that we're paying today on healthcare. And the way you fund it is we're paying premiums already. We pay every month for our healthcare premiums. Let's just shift them over to the Medicare for all, and we funded it. In fact, we might even get a deduction in what we're paying now because, like I said, other countries do it for less. And it should cover eye, hearing, dental, mental health parity, and with good reimbursement rates so that our rural clinics can stay open. That is absolutely critical because we have watched the clinics in rural America disappear at an alarming rate, and that not only makes my family live in an unsafe situation, that makes our communities unsafe, and that makes our country less safe.